And good morning. It's July 10, 2025. I'm Dr. Duke Majan. We're going to be streaming live spine surgery on our patient who's had back pain since 1999, hence the theme song from Prince in the background. All right, if you have questions, feel free to ask. We can lower it. All right, our patient has back pain for many years. What is that, 26 years, right? And he's had a procedure done in the past in Arizona by one of my mentors, Dr. Anthony Young. So we're going to be fixing two discs today, L4-5 and L5-S1. If you have questions, feel free to ask me. All right, we're way too low there. Our first step here is going to be get the needle into the discs that we're fixing. And to do that, I have to use an X-ray machine to guide the needle placement. Shot. All right, we're making some progress. If you can see the X-ray, the needle is just next to the facet joint. The facet joint is a type of joint in the spine. It's located in the back of the spine. Can I say booty call? All right. You see the way she bailed out of here, right? Like most people wouldn't answer their phone, but it must have been an important one. We all want to know, is that a booty call? No? What was it? All right. So folks, back pain, very common problem. Millions of people suffering with it. The big question is, what causes chronic back pain? And turns out Duke Spine Institute has discovered 30 common causes of chronic back pain. And each person has a slightly different combination, but the causes are pretty much the same. Let's go ahead and show the audience in our animation the different causes of back pain. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the DISCS piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. All right, welcome back. You can see from our video that there are 30 specific causes of back pain. So when somebody says, I have back pain, chronic back pain lasting more than 2 weeks, the back pain's coming from something. Now, it could be a cancer, tumor, infection, but those are so rare, less than 0.1%. Most chronic back pain is coming from a disc injury. Call that disc injury a herniated disc or bulging disc, ruptured disc, slipped disc, extruded disc, protruded disc, spondylitic disc, degenerated disc. They're all the same thing. Basically, it's the same problem, a tear in the back of the disc where the jelly from the center is pushed out into the tear and it's causing inflammation. That is the source of the back pain. We discovered that here at Duke Spine Institute. I discovered it as the founder about 20 years ago, and we've been treating it with laser endoscopically for 20 years. Our success rate is 99.6% of the back pain goes away. Goodbye with this surgery. That's if the back pain's coming from the discs, which his is. But he also has back pain coming from his torn piriformis muscle, so we're going to fix that later. Now, we're going to do a discogram to see how much pain he gets from this L4-5 disc. I would do it at L5-S1, but I can't get the needle in there, so I'm going to wait till he's asleep, and then I'm going to try a different technique. How you feeling, buddy? He's had back pain since 1999, which is why we started this surgery off with Prince's song, Party Like It's 1999. Now he's going to party because he's going to roll back all the years that he suffered in pain. Today is going to be the last day of that pain. He's had it since 1999. That's the kind of friend you don't want in your life. You want to get rid of that pain. All right. How bad is that on a scale of 1 to 10?
Give us a number.
How high did it go?
10.
Was that where you get your back pain? All right, my friend. When you wake up, that's going to be gone. 10 out of 10 concordant at L4-5. Unable to test L5-S1. Okay? So L5-S1 not testable. Folks, this is a day to celebrate. That's why we're going to party like it's 1999. because we've just discovered and confirmed that the L4-5 disc is indeed causing his back pain. Now, if you look at that x-ray, I injected the dye in the middle of the disc and it leaked out and it went all up and down his spinal canal. You could see that dye going up and down. You could see the herniation. Show us the herniation. Look at the herniation, just circle it. It's like a mushroom right there. There it is. Jordan is circling it. It's not got dye in it, this type of dye, but it'll have the blue dye. Any questions?
No current questions, but we do have a comment coming from Edward on YouTube.
Hi, Edward.
Saying DLDR 4 years ago, this September, best decision ever.
Oh, Edward, thank you for sharing. You know, we've had a string of our patients come back on this stream now and report to us how they're doing. And you are probably the fourth one this week. So thank you so much for sharing your experience with other people. You know, the DLDR is a very special procedure. It's the only procedure in the world that eliminates back pain from a discogenic back pain. That's what we call it. So Henry, let's show the audience, how is it that a disc injury causes back pain?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. So you can see from the video that trauma, some type of an injury like you fall on the ground or you fall off a roof. And by the way, if you're wondering, like what kind of trauma causes you to herniate your disc or tear your annulus, just watch a channel called Fail Army. And it's basically a series of videos of people just doing stupid stuff and hurting themselves, okay? Now, at the time, you don't feel the pain, but that's when you injure the disc, and then over time, you herniate through the tear, and those herniations cause inflammation. It's the inflammation in the disc that causes back pain. And I've been trying to teach other doctors, other spine surgeons about this for years, but they don't listen. They think they know everything already. It's amazing how arrogant and ill-informed they really are. But we've been trying to help patients by educating other surgeons. They just don't want to hear it. They want to keep doing their procedures that don't work, like discectomy or laminectomy. But that's why we're going straight to you guys through these videos. We want the public to know the truth. We don't want you to be victims anymore of other doctors' ignorance and selfishness, basically. All right, so here we are inside the L4-5 disc. And you can see the tear and you can see some inflammation right there. See the pink stuff? That's where his back pain is coming from. Any questions?
At this moment, no current questions.
Well, then let's show the audience how it is this laser can actually get rid of people's lower back pain when it's coming from a disc injury and a disc herniation.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Great. So you can see from our video how the laser is used to what's called debride. It's a surgical term. It means clean up and get rid of all the junk in the annular tear. This is the annular tear right there. You're looking at it. That's the tear. And this blue stuff is herniation that's stuck in the tear, trying to escape the disc, get out, and hit the nerve root behind us. So we're using the laser to get rid of the herniation stuck in the tear, which is the source of back pain, and to get rid of the herniation that was pinching the nerve, which causes the leg symptoms. It turns out he has two causes to his sciatic. Number one, he has the herniated disc, which is pushing and irritating the nerve root, causing sciatica. And number two, he's got piriformis syndrome. Now, piriformis syndrome is basically a muscle in your butt that gets torn deep inside, right where the sciatic nerve runs, and it's the second most common cause of sciatica, okay? None of this was taught to me by my residency program. It was all stuff that I had to learn from my patients over the years, the truth. And so that's why a lot of doctors don't know this stuff. I actually had to study my results and understand why people were getting better with our treatments. And when I figured it out, I realized we're doing something nobody else is doing here, and it's working. And that's why we're able to cure these people's back pain. It all starts with making the right diagnosis. And that's what we do on our free MRI review. If you or somebody you know has back pain, I recommend you get the free MRI review. It literally takes 10 minutes of your time to submit the form and the images, if you have them, the DICOM images for your MRI, and then another 10 minutes to get the appointment scheduled and 10 minutes to get the appointment done. So in 30 minutes of your life's time, you can have answers as to what of those 30 causes of back pain, what's causing yours. We also do this for neck pain, and we do it for thoracic pain. Pretty soon we're going to be launching our Duke Joint Institute website, where we treat knee pain, shoulder pain, and hip pain. Basically pain in arthritic joints. We use our Duke plasma rhizotomy technique to do that. Our initial patients we've done the knees for. Dr. Patel just got done looking at their outcomes, and it turns out we've had 0 complications. We've had 75% elimination of knee pain. That's patient reported 75% average elimination of knee pain. Of course, there's a few hundreds in there. There's some 90s, some 95, some 80s, some 50s. But overall, 75% of people's arthritic knee pain gone in a 10-minute procedure that doesn't involve opening them up or going to the hospital or having a metal or plastic knee put in. They've also just released information that artificial knees and hips are leaking pieces of metal into your bloodstream and spinal fluid, which is causing dementia to happen. So all these artificial knees and hips are actually causing small micro metal fragments to be absorbed into the bloodstream and distributed to your spinal fluid, and then it goes to your brain and causes basically brain damage. That's one of the reasons people are getting Alzheimer's disease, okay? Memory difficulty, cognitive difficulty. How would I know? I'm a brain surgeon. For those of you who don't know, Dr. Duke Majan is a brain surgeon. So not only do brain surgeons do brain surgery, we also do spine surgery. As a matter of fact, the best spine surgeons and the most spine surgeons are neurosurgeons. Any questions?
No current questions, so we do have a comment coming from Edward once more on YouTube. Following up on his DLDR 4 years ago, this September, saying L3-4, L4-5, L5-S1 took Dr. Duke forever to get into L5-S1, and thankfully he was persistent to get in the repair. Dr. Duke will remember me from counting down in Korean.
Yes, thank you so much, Edward. We love hearing from our past patients, and I do remember you, and I'm so happy you're doing well. 4 years ago, your surgery, what a life-changing event to have your life back without pain. And that's what this patient is doing. I could tell you a little more about this patient. He's actually had endoscopic spine surgery done by who I consider to be one of the best in the world, Dr. Anthony Young, who was my teacher. He was my greatest spine teacher, my greatest spine surgeon teacher. And he wasn't even part of my academic training at the University of Florida. At the University of Florida in Gainesville, I went to the very best neurosurgery training program in the world under the direction of Dr. Albert Roten, probably one of the most famous neurosurgeons, most respected neurosurgeons. And I trained with Dr. Roten, Dr. Bill Friedman, Art Day, Rick Fessler, Pat Jacob, and many others, Jeff Henn, Parker Mickle. These are some of the top neurosurgeons in the world in their fields. That's why the University of Florida was the top training program. But none of them taught me as much as Dr. Anthony Young, who is not even a neurosurgeon. He's an orthopedic surgeon. And he was practicing in Arizona, Phoenix, Arizona, for all of his career. And he invited me to come out and learn how to do endoscopic lumbar back surgery. And I had already gone overseas and learned from Sebastian Reuten and Sang-Ho Lee and also Dr. Young. But he continued my education here in America. And I made many trips to his surgery center back in the early 2000s, where he would graciously invite spine surgeons to come and train with him to learn the technique, okay, of how to do the lower back surgery like I'm doing now, except he didn't use the laser. He used a different tool called the grabber, which I'm about to use now, and he also used a bipolar. Now, as much as I love Dr. Young, he's unfortunately, like many doctors, they're looking for ways to augment their income, and so he was promoting the bipolar because he actually designed it. It was called an Eliquis bipolar, and he was trying to get everybody to use it, but he got royalty payments for every one of those bipolars that were sold. So he was promoting the use of that bipolar. Now, I don't get any royalty payments on anything I do. I'm just a surgeon doing surgery, so I don't promote anything. I don't get royalty payments for anything. I just promote what's best for my patients, what gets the best results, what's the safest, what's the most effective. And that, in my opinion, is how a doctor should be. Now, if you want to move out of medicine and stop treating patients and go sell devices, then do so. But don't try to promote devices and bribe surgeons to use your devices. And Dr. Young did not bribe anybody, by the way, but these other companies, these biomedical device makers, are basically paying off surgeons to use their devices in patients. The next patient coming up, she's here with a spinal cord stimulator. She's had fusion surgery, she's had spinal cord stimulator, she's had every device put into her body because that's how surgeons get rich. That's how medical device companies get rich, and that's how hospitals get rich. They get rich by doctors putting these devices into people's spines and backs. But these devices don't work. That's the problem. This surgery works, but we have no devices. And so the device companies don't want this surgery known about. As a matter of fact, the entire industry doesn't want my surgery being known to you people watching. They want you all to believe your only options are laminectomy, discectomy, followed by fusion and artificial disc and stimulators, and lots of pain management procedures that make them rich. But you guys deserve to know the truth, and that's why we broadcast. But we're the only voice telling you guys the truth out there. Everyone else is basically lying to you about the truth, and they're hiding and suppressing the real truth, which is that we can fix them with laser and plasma and no implants. So we've had a tough time over the years getting the message out. We actually created a viral video a few weeks ago, which got to over 1.5 million people. So that was the first time we were successful at reaching a large number of people with our surgery. And it's sad because to get a viral video, we had to be negative. We had to do some negative stuff. But we decided we were going to do that because we needed to get the word out. Too many people are suffering. So we had to create a viral video so that people will find out about Duke Spine Institute. Yes, of course, you could say, why create something negative? And the answer is because that's what you people want. We've been creating positive videos for 15 years, and nobody pays attention to positive videos. They all want negative. So that's why we created a negative video, and we got 1.5 million views just on TikTok. All right, and then we got another 500,000 views on other platforms. So we did really good. Right, Sam? Sam's like, oh shit. Alrighty then. They have an old saying, when you're given lemons, make lemonade, right? Don't cry. Just make the best out of it. Any questions?
We have a comment and a question. This next comment is coming from Frank on YouTube,
Hello, Frank.
saying, hello, Dr. Duke and everybody. I just wanted to say hello and let you know I'm still watching your surgeries. Everybody working there is top notch.
Frank. Great to hear from you, my friend. I hope you're doing well. Make sure you go see those doctors we talked about and get your legs taken care of, my friend. Look forward to fixing your neck someday and getting you feeling better in your neck. All right? Thanks for joining us. And it was Frank's idea for us to do a podcast, and we did it. Henry actually is editing our intro. Actually, the intro is done.
Intro is done, ready to go on that. We're editing we got a few videos ahead, and then we have the first episode in process, and then right after we have a second episode ready to go as well to be edited.
We got a lot of them ready.
A lot,
right?
yes.
And we're going to put a bunch of the ones we've already shot on there as well.
Exactly.
Yep. Scope off. All right, we're finished with L4-5. Remember, we tested this disc. It was 10 out of 10 pain. So I know 100% with the use of the evocative discogram that this was hurting the patient. All right. We're going to take our tube out, and we're going to do the L5-S1 next. Any other questions right now?
Yes, we have a question coming from Lanu on YouTube.
Hi, Lanu. Come on in, Jordan.
Asking, what is the treatment for people
No bleeding.
for people who have arthritis on their facet joint?
Lanu, you're too funny. Lanu is vying for Henry's job. I love it.
See where they're getting at. Yeah.
Right?
Yeah.
Good for you, Lanu.
Yeah.
Thanks for keeping us on the ball.
We appreciate it.
You're right. You're right. So, Henry, why don't we show the audience how we treat facet joint arthritis pain?
Of course.
The best way to treat it. The only way that actually works and is permanent.
Of course.
Thanks, Lanu.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Thank you, Henry and Lanu. That was our video on how do facet joints cause back pain. So we showed you at the beginning of the surgery a video on the 30 causes of back pain. And the most common is disc. Like this patient has 2 discs that are causing his back pain. The second most common is the facet joints. All right, was it the, it was the 4-5 with the big one, right? Jordan?
Yes, sir.
Shot? All right, get the guide wire, hold on, get the guide wire out. It's probably pinched, yeah. So the audience watched the facet, how the facets cause back pain.
Correct?
Did they watch how we fix facet pain?
Of course.
Oh, okay, good. All right, they're maybe stuck there. So this disc is L5-S1. And remember, this is the one he's had prior surgery on. It's pretty collapsed and very scarred. And that's why it was so hard to get into. Because it's had so much inflammation for so many years. And he's had surgery on it already. So that surgery also caused scar tissue. But we're in, and I'm very happy we're in. We're good. We're going to get this done. Once we fix this disc at 5-1, we're going to end the stream. We're going to go to the piriformis release on the left. All right. Any questions?
Yes, we have a question coming from Lanu once more on YouTube towards me saying, "Dear Henry, can I take over your job if you retire someday?" Well, I am 26, so got some 40 years ahead. So
It's broken. It's broken. Laser. Well, Lanu, I mean, aren't you a nurse, Lanu? I thought Lanu was a nurse in Singapore or Malaysia.
that's what I thought. Yeah.
I think she is, right?
Hey, if she's interested in digital media.
Yeah. Well, Lanu, we would love to have you come work at Duke Spine Institute. We're always looking for great nurses. And I don't know if you're taking care of patients where you are, but I thought you were a nurse. Maybe you're not, I don't know. Maybe you can tell us. I thought one time you told us you were in either Indonesia or Singapore or Malaysia, that you were a nurse over there. Okay, yeah, thanks. All right. How much are those? Like $750? How much is the grabber? 900? Yeah, one of our grabbers, they're very delicate, unfortunately. I think they designed them to break, but they're about $1,000 for one of these grabbers. I bet you we could get one made that's more sturdy, Luis. Why don't you send that broken one to them? See if they can design one that doesn't break so easy. Because it's not an implant, so we don't have to worry about that. Just see what it would cost to design one that's that long and that skinny, but has a good strong grab. Because the problem is the grabbing mechanism. That's what's going to be challenging. I don't know why they design it with that thing in the back that breaks so easily. Any questions?
At this moment, no current questions.
All right. I'm just lamenting over the fact that some of the instruments that are designed for surgery like this are not as sturdy as they could be. And it reminds me that when I was a kid growing up, everything was built to last. cars, refrigerators, washing machines, dishwashers. You okay? You want to go get an MRI? So nowadays it seems like manufacturers design things to break so that they can charge you to repair it. And it's really sad that that's the way things are. So I don't believe in that philosophy, and I always oppose bad things. That's just my nature. So I think we're going to try to find a way to redesign the grabber so that it's sturdier. All right, Luis?
Yes, sir.
Any questions?
At this moment, no current questions.
Yeah. After all, if we're always having to replace equipment at a very high price, then that increases the cost of the surgery for patients. So we don't want to do that. We want to keep the costs down so that people can afford to do the surgery. But to do that, the cost of the supplies have to be, controlled. They have to be reasonable. They can't be high.
No current questions, so we do have a comment coming from Frank, once more on YouTube,
Yes, Frank.
saying, found out that Snap-on makes one of those grabbers. They give lifetime guarantee.
I love it. But we can't use, things that are not meant for a human body in surgery. That's the only problem. I love it, though. Thank you. Snap-on. Well, we might be able to. We have to look and see. I just can't imagine it's that long, though. We do. They may. But, we actually have what is that wrench we have that we use to get the tube out? A vice grip.
Yeah.
We actually have a few vice grips. So I guess you can technically use, certain metal devices as long as they're autoclavable and you're not implanting it, obviously. The FDA, the Food and Drug Administration, regulates anything doctors either put into a patient that stays in, like an implant or a biologic, drugs. So they regulate those types of things, but they don't really regulate other types of things. So things that don't go into the patient to stay, they don't really regulate. All right, did Lanu answer us or not?
They did not, no.
Maybe she's busy.
Yeah.
I remember it's like 12 hours ahead, right, for her?
I believe so, yeah.
So it's not too late. All right, we're just about done with this disc. This is the L5-S1. You can tell it's very scarred. There's the inflammatory tissue causing his pain. We're going to get rid of that. Now, he traveled here from Arizona across the country with his wife, and they could have gone back to Dr. Young's clinic, but they chose to come to Duke Spine instead. And that's because he said he watched 100 of my videos online, and he felt very comfortable with us doing his surgery, which I'm glad he did. Because unfortunately, when Dr. Young left, his son took over, Chris. Chris is a great guy, great surgeon, but their focus now has shifted from endoscopic to fusions. So this move right here is what puts the most strain on it. See what I'm going to do? I'm going to open it, and I'm going to grab the disc, and I'm going to push it downwards, okay? And that kind of forces the mouth open. Do you understand? And that's where it fails, I think, biomechanically. It's that opening and pushing. You understand? So I come like this, I open it, and then I push forward, and that may be the reason. Okay? But I need to do that when the herniation is all scarred in there, It's the only way I'm going to get it out. Any other questions from our audience or comments? Because we're going to end this stream, and we're going to come back with a new stream in a moment where we do his piriformis muscle release.
At this moment, no current comments or questions.
Once again, we're treating L5-S1 currently. You can see this is all scar tissue from his prior herniation and surgery that he had. and there's herniated disc right here, stuck here in the annulus where it should not be. It's out of place. It's stuck here in the annulus and it's scarred up. So this is where all the pain is coming from. And this is what's pinching the nerves going down his leg. This really hard material.
We just got a question
Sure.
coming from Michael on Facebook
Hi, Michael on Facebook. Welcome.
saying, is it only the inflammatory tissue that's causing pain?
Yes. It is only the inflammatory tissue causing pain. You are correct. Everybody thinks spinal stenosis causes back pain. It does not. Everybody thinks it's bone spurs causing back pain. It does not. Back pain has zero to do with bone spurs and spinal stenosis and pinched nerves. Zero, zero, zero. It has 100% to do with inflammation. If you don't have inflammation in your disc or facets, you are not going to have back pain. So the 4 places you get inflammation that causes back pain: discs, facets, SI joint, piriformis muscle. And again, that was discovered by Duke Spine Institute, and we know exactly how often those things get inflammation and are the cause of people's back pain, and we're able to diagnose it in almost 100% of patients. We have 99% diagnostic accuracy. So if you want to know what's wrong with your back or neck, you do an MRI review at Duke Spine, or you come into our office and get seen, and we'll tell you. But you got to have an MRI, and we have to do an examination. I got about 1 minute left, and then we're going to end the disc, and we're going to move on to the piriformis. Everybody ready? Any other questions?
At this moment, no current questions.
All right, I just got to finish this last bit. Ariana, great job on the laser. Nikki, great job teaching. All right, this last bit of herniation and scar tissue. This is old, really old. This has been here for probably 25, 30 years. All right. Just about done, 10 seconds. And go ahead and show our audience. Oh, actually, we're going to go straight to the piriformis. So we'll just end the stream, and we'll restart with the piriformis release.
Copy that.